procedures for skin cancers to treat them is Mohs surgery, radiation surgery, scraping or burning, what's called electrodesiccation and curettage, or excision without Mohs, which is just removing it without having to do the Mohs. And in some cases, select cases, you can use topical immunotherapy with a medication called imiquimod or Aldera.
Tell me about the Mohs skin cancer surgery that you perform.
Yeah, we do a lot of skin cancer surgery here, and that's a procedure. Mohs is a procedure where the tumor is removed very carefully to ensure the highest cure rate and the lowest chance of recurrence. When you remove a cancer, you want to make sure that you get it all out, okay, and that you leave the smallest possible defect or scar. And that's what the Mohs technique is all about. As part of the Mohs, I also do the plastic surgery reconstruction following the removal of the cancer, and that is all done at the same day, same location, in the same place.
We saw one of your patients, I think her name was Teresa, and her scar, you couldn't even see it.
Correct. Correct.
You do great work.
Yes, and as a dermatologic surgeon, we are trained in plastic surgery techniques. During my residency, I was trained by plastic surgeons in closures, flaps, and grafts, and other reconstructive treatment options.
So from the skin cancer, you can go from the biopsy to taking the skin cancer off and doing a reconstruction?
Correct. Correct.
Wow.
There are many different treatment options for skin cancers, and Mohs surgery is one of them. With all my patients, I do give all the other options that are available. In some cases, Mohs may not be the best option. We may want to do radiation therapy, and in some cases we want to do combination treatments with topical therapies in combination with other treatment modalities. So Mohs is not the only answer. In this practice, we make sure that we cover all our bases and give patients the best option to treat their cancer in that specific location.
So what are the other treatment options besides Mohs?
The other treatment options for skin cancer is radiation therapy, and that would involve going to the hospital on multiple visits to get treated with radiation. Depending on the locations, in some cases you can scrape it and burn it, and that would leave a tendency to have a round whitish scar as opposed to a cosmetic line scar. Just cutting it out without the Mohs, but when you cut a cancer out without the Mohs, you tend to take wider margins, so there's a risk of leaving a little larger scar and the potential that you didn't get it all out the first time and having to come back and do it over.
What do you mean by the Mohs? Because I really don't understand that.
Yes, Mohs it could have been the Rumbawa technique if you had invented it, but Mohs is the last name of Frederick Mohs, who invented this technique. And what this technique involves is the removal of a skin cancer and checking the margins all at the same day. For example, when we take out a cancer, we take that tissue out and we're going to look at it, and we're going to look at all the margins in a circumference and in the deep plane to make sure it's all out. The analogy is a key lime pie. If we scoop out a piece of key lime pie, we want to make sure that we got all normal crust and that all the filling, which is representative of the cancer, is not penetrating through the crust.
Okay.
And when we see that in the Mohs, and we know that it's all normal skin or normal crust, and there's no cancer penetrating through, then I can tell you we've got it all, it's all clear, and we're done. And that's the Mohs technique.
Okay. Wow. So there's, what other treatment options you were talking? You did the nitrogen?
Yes, liquid nitrogen. That is a treatment for pre-cancers, or what we call actinic keratosis. Those are not skin cancers per se, but they're pre-cancers. If left untreated, there is a risk that some of them can develop into skin cancers.
Okay. So you were talking about actual cancer treatments,
yes,
as
actual
opposed to pre-cancer.
treatments.
Okay.
Yeah, there are three major types of skin cancers: basal cell and squamous cell, which is what the Mohs is primarily for.
Okay.
And melanomas is the most deadliest of all skin cancers, and that typically is not treated by Mohs. In select cases it can be, but it typically involves other different treatment modalities.